it's going.
Hi, my name is Tabitha. I live in Beaverton with my husband and son. I have a son with autism and mental retardation who's 20 years old. Our son started receiving in-home services about 12 years ago. Those services enabled us to keep him at home and keep our family together. Because of his severe behavior and communication problems, there were times when, without in-home supports, we wouldn't be able to keep him safe or me safe, other members of our family safe. But because we did receive in-home support, my son's behaviors have been able to maintain for long periods of time at a calm and comfortable level. Our family unit's been kept together, and our quality of life is greatly improved. If we didn't have in-home supports, my family would have gone into crisis, my son would have gone into crisis on several different occasions, and we would have fractured apart. But having in-home supports allows the proactive move of keeping that family together and keeping the person with a developmental disability in a place where he can be an active and productive member of his family and his community. And that's why the enormous value of the dollars the legislatures divide out is most importantly put into in-home support. Putting dollars into crisis management is only going to, I should reverse that, by not putting money into in-home support is only going to guarantee multiple people going into crisis management. And it's not something that's sustainable. What I learned early on when my son was diagnosed, that if I was going to make a difference in his life, if I was going to know that after my death, my son was going to continue to have some kind of stability, some kind of safety, any kind of a happy life, I had to advocate with the state and federal legislature, because this is where programs are created. This is the heart of the support for people in the developmental disability community. So to secure your life, liberty, and the pursuit of happiness, the only way that you can make sure your child is going to have those garnered things is to get to know your legislators and have them, to the best of your ability, understand your person's life and your life, the needs for the supports in this community. Right now what we're talking about is unionizing. People who work with people with developmental disabilities being able to join an existing union so they get health care and a fair wage. As a parent, I want to be able to know that people that work doing in-home support are going to stay in that position for more than 3 or 6 months, that they're going to devote their careers to working with people in the developmental disability community, that they are valued. These jobs are not easy jobs to do day in and day out. They're physically taxing, they're emotionally taxing, and if we don't respect the position, the value that these workers have in enhancing our children's lives, we're not going to have anyone that's going to be around to secure their safety and well-being upon our deaths. So this is a time to really focus on allowing, giving support to people who are doing in-home work to join a union so they get the respect of the very difficult jobs that they do day in and day out for our families.